Okay, I'm Heather, and this is Tarek. I'm going to talk about PTSD using the Teach Back method. Hi, Tarek. My name's Heather. I'm here to see if there's anything I can help you with today. From what I've read in your chart, you and your family traveled from Syria to get away from the war. Spent a couple of years in a refugee camp before coming to the United States. Is that right?
Yes, me and my wife and my 3 children left Syria because of all the war that was going on there. I had to get my family to safety. It's been a long journey and we've been through some difficult times, but I've been trying to find a job in the United States. It's been tough.
I can't imagine what you've been through. I see that you were an engineer in Syria.
Yes, I made a good living, but everything is different now. I can't seem to focus. I have difficulty concentrating and sleeping. I really need to get a job soon. My family is depending on me.
Tell me more about your inability to focus and concentrate.
I don't know. I just feel like I'm constantly worrying about how I'm going to provide for my family. Sometimes I wake up in the middle of the night having bad dreams from back home when the war was going on.
It sounds like you might be experiencing some post-traumatic stress disorder, PTSD. Has anyone ever mentioned this to you?
I've heard of PTSD, but I thought it was more for soldiers in the military.
Actually, anyone can experience PTSD. It's very common among refugees. Up to 70% of people going through your similar situation can have some levels of PTSD.
I guess you might be right. I haven't felt like myself lately. I'm constantly worried about the future. It makes me irritable and sometimes angry.
Would it be okay if I taught you some ways that you can deal with these feelings, some ways to manage PTSD?
Yes, definitely.
Okay, one thing you can do to overcome PTSD in your situation is to focus on the positives. Can you think of some positives that have come out from your experiences?
Well, I'm thankful that my family and I are safe here. We are away from the war. We have opportunity here. I'm also looking to find work soon, and eventually we can get our own home.
I'm glad you can see the positives in your struggles. Having a positive perception about your life and your journey can really help you work through those worries that keep popping up. If you have a positive outlook on the future, your family will see this and you'll be giving them hope as well.
I see what you're saying. I think I can try to be more positive.
Would it be okay if I ask you about your religious beliefs?
Yes, of course.
A lot of people can find healing by praying and surrounding themselves with a local church community. Are you involved in anything local like that?
My family and I are Muslim. There's a mosque nearby that we have been attending.
Well, that's good. Religious practice and praying can be really beneficial when dealing with traumatic events. There's probably even a lot of people that have gone through some of the same struggles you're dealing with. I would encourage you to try to see if they offer any support groups that you can get involved with. This could be really helpful when dealing with PTSD and the symptoms you're having.
I think you're right. My family and I pray together regularly, but I haven't looked into any groups to get involved with. I will ask and see what they offer.
That sounds great. Another option I want to mention to you is possibly meeting with a medical professional to help you cope with the struggles you're having. Often doctors will prescribe medications to help treat the symptoms of PTSD, possibly an antidepressant or anti-anxiety medication, or maybe just something to help you sleep if you're waking up with nightmares. The medications can be short-term while you adjust to your new life here. It's not something you have to take forever. They can even have recommendations for a therapist in the area if you just need someone to talk to. Talk therapy can be a really effective way to help manage PTSD symptoms as well.
I'm not sure I want to take any medications, but I think I'll try being more positive and getting more involved with my religious community first. But I'll keep that in mind if things don't get any better soon.
That sounds like a good plan. I have some paperwork here I can give you with information about PTSD just so you can learn a little bit more about it and some coping skills you can use. And at the bottom, there's a list of doctors and therapists in case you change your mind about therapy or medication. Thanks for meeting with me today.
Okay. Thank you very much, Heather.